is UPN 9 News.
Let's try an experiment. If you wear glasses, take them off. Now look at me. Am I a little blurry? If I am, you're probably one of the 70 million Americans who are nearsighted.
Well, Brenda, until tonight, you had three choices: glasses, contacts, or the scalpel. Now there's something new: computer-assisted laser surgery that promises the miracle of perfect eyesight. After years of testing, the FDA has now approved it. And if you have 60 seconds, you could have it done tomorrow.
I mean, there's not a day goes by that I don't appreciate having had it done.
I'm really looking forward to it.
95% of our patients are able to, with one treatment, are able to do without glasses completely.
It's called photorefractive keratectomy, or PRK. It could change the way millions of Americans see the world.
That was my life. Wake up, put your contacts in, and wear them all day long.
Susan Marchione was nearsighted and nearly helpless without her contact lenses. 25% of Americans are nearsighted. That is, they need corrective lenses to see things at a distance. Susan's eye doctor, Joseph Dello Russo, told her about a new laser treatment.
In the eye, basically the cause of it anatomically is the fact that either the front of the eye is too curved, the cornea is too curved, or the eye is too long. So the rays don't focus where they're supposed to. With the laser, what we're trying to do is spread those rays apart so that they fall directly on the back of the eye. And we do that by making the front of the eye, the cornea, somewhat flatter.
Susan had her experimental PRK operation in 1991 as part of the FDA approval process for the technique. She's never looked back.
This is one of the best things I've done. May 8th, 1991 was kind of a date that will never be forgotten.
PRK has been available in Europe and Canada for years. In this country, it's been performed on about 700 people in clinical trials over the past 5 years. Dr. Dello Russo has performed about half of those procedures.
I'd like to do the right eye first because my left eye is my camera eye.
Beginning today, it's available as a regular procedure for people such as Barbara Saruga. She's been wearing corrective lenses since she was a little girl.
Without eyeglasses or glasses, I'm practically blind.
Now she's come to Dr. Dello Russo for the laser treatment.
I don't know how many times I've dreamed about not being able to see without having to wear glasses or contacts. I've prayed about it even.
This is really important to you.
I am actually going to take a little picture of your eye here.
Computers map the interior of Barbara's eyes in preparation for surgery in several weeks.
Is actually telling us that you don't have any other kind of eye diseases.
Oh, great.
Every aspect of her vision is measured. The data will be fed into the PRK machine's computer and will guide the laser through the procedure.
The object of the treatment is flattening the cornea just enough for each person's individual prescription.
The doctor uses the computer-guided laser to shave down the cornea. The procedure is done under a local anesthetic.
Each pulse of ultraviolet light is actually vaporizing a very thin, microscopically thin layer of cells. There's no pain at all. And that's because only treating the surface of the eye, put a couple of surface drops of anesthetic in, and makes the cornea, while we're treating, numb. And there's no pain during the surgery. Later on during the day, there often is pain because what we're doing in the treatment by flattening the cornea is also creating like a rough surface, so you're getting a scratch.
And in less than a minute, it's over, except for the critical healing phase.
Post-operative treatment and care is probably as much as important as the laser itself.
More than half the 700 patients who had trial PRK operations now have 20/20 vision, or better. 95% have 20/40 eyesight without glasses or contacts. The technique is not 100% foolproof.
There's always risks, but in any type of treatment, and I don't mean to be cavalier about that, but we've done so many patients that we pretty much know what the risks are. And for example, the laser is approved to treat up to, I'll give you a number, like -7 diopters. That includes almost, it doesn't mean much to you, but it includes about 95% of people who are nearsighted. And in that group of people who are nearsighted, who we have treated up to that degree, we haven't had a single case where after 2 years, for example, there's been any impairment of vision.
I've fallen asleep with my contact lenses on a few times and woken up in the middle of the night and blinked a few times and said, oh my God, it's a miracle, I can see. Like, so excited, wow. And I can't wait to be able to wake up and know that it's real. It's not just a dream.
Just changes your life.
If you need glasses to read or see things close up, you're farsighted. Now, they are working on a laser treatment for that, but it's much more difficult, and they don't expect a treatment in the near future.